All right, here we are for another great community session for our social community, social justice virtual symposium. So now I am pleased, proud, happy to bring to you three more great community organizers and community services and supports within our local area that support our broad, diverse community in Charlotte. So, as we've been doing, I want to kind of just generally introduce because where you may be in watching this, if you're here and this is your first session of the day, or if you're watching this online, this is the part of a series as we round out Social Work Month to bring together community. And that's really the theme that we've had as we've been discussing university services, as we've talked in our first session of community-based services that focus on the needs of our broader population and our diverse population in Charlotte. We looked at the unhoused population, LGBTQ population, justice and justice impacted population, as well as education services and how those different needs intersect and engage with our broader community. So now we're going to go in a continuing direction, and I don't want to say a different direction because the needs that people have, you never know when you're going to need them. So it doesn't mean that you are a part of a specific community that you can only access services that are said to be dictated for that community, the needs that you have or the needs that you have wherever and whenever you need them. So here, we're going to bring together some other great services, including those of, I'm going to introduce our panelists. I'm going to let them start by discussing the services and the work that they do. So I'll start with Melinda Plue. Is that correct?
It's Plue, just like that. Yep, just
Plue,
like that.
perfect. Thank you, Melinda. Let's talk about the work that you do with ARC-NC.
Of course. And tell me how long I should go. And if I'm going too long, you just tell me to stop, okay? Because I don't know.
I'll jump in if we need to. If we need to
Okay,
make a break in between, go for it. But until then,
please
I'm gonna give you
do.
the floor.
Please do. Okay. Hi, everybody. Live and recorded. My name is Melinda Plue. I have the great fortune to be able to do work that I quite honestly would do for free. I don't know how many of you in life will ever get to say that, but I have the great privilege to do that. I have worked my whole career in the field of intellectual and developmental disabilities and providing both advocacy and support for that group of people who are the most marginalized, the most oppressed across all cultures and generations is work that is both personally meaningful to me as well as professionally meaningful. That is my opening. My role is as Director of Advocacy and Chapter Development. It's a long title for an organization called the ARC of North Carolina. Now, I don't know if any of you in your lives have heard of the ARC. If you are as old as I am, you may have heard it referred to as the ARC. That's wrong, just so you know. But we're still around. We are an advocacy and provider organization statewide, nationally, in fact, as well as locally, that provides both support and advocacy for people with diagnoses like autism spectrum disorder, cerebral palsy, Down syndrome. The list goes on and on. And we provide that support and that advocacy for somebody from cradle to grave, meaning when they come to us, meaning they move to North Carolina or they are born until they die or until they move away, if they so choose. It is a real privilege to do that. It's a very large population. My role is in supporting families. I foster a lot of family support. I foster things like self-advocacy and really champion the voice of self-advocates. That's the word we use at the ARC. Instead of using a word like client or customer, we say self-advocate or just person supported. Crazy. We just call people by their name. And it is work that I love. For purposes of today's presentation, I will say a couple of things. One, I am local to you. I have a statewide role, but I'm a UNC Charlotte grad, and I live in Union County in Monroe, and my office, though it's statewide, we have a large presence in both North Charlotte and in South Charlotte and in the surrounding counties. So if I can ever be a resource to you in your work in the social work field, it is something that is close to my heart. I just came back from Washington, D.C. Not 1 hour ago, and I have spent the last 3 days with 1,000 people with intellectual and developmental disabilities and their caregivers and some provider organizations, and we've come together to do real macro social work practice. We are doing advocacy for change, meaning we're teaching people with disabilities how to share their stories, how to make a meeting with a senator or congressperson less intimidating, make it accessible in a world that often isn't accessible, and really have some collective impact. That's work that's very, very important to me. So I'm coming off a high from that, but I don't want to take too much more time away from somebody else, but I'm so happy to answer any questions about the services that we provide, the work that we do, how I can be helpful to any of you in your journey.
Thank you, Melinda. That's actually going to be the next phase after we get our introductions. We're going to delve into the work that you do,
Okay.
and especially the successes. 'Cause I think it's really easy for us to focus on the barriers that we miss the successes that even whatever that looks like. Success, I'm not going to define that for anyone, but success as it comes to us. So we're going to definitely come back to you, Melinda, there to discuss more of those successes, especially as you're coming back from DC. And the experience there when it comes to advocating for directly, because that's usually where we talk about that macro space is taking it to the top, and the top not being, over people, but to the top of our systems. And the federal government is one of those layers. So we'll definitely come back to that conversation. So we're going to put a pin in
Okay.
it, and we're definitely going to come back. So switching gears, thank you there, Melinda, to Amelia Keomuongchanh. Hopefully I got close.
That was
And
right.
all right, with OurBridge for Kids,
Yeah.
tell the people about the work that you do and yourself as well.
Yes, perfect. So I'm Amelia. Keomuongchanh was right. The long last name, my parents are from Laos. It's a landlocked country in Southeast Asia between Thailand, Cambodia. And the services at OurBridge for Kids. So my role is actually the volunteer engagement manager. So lots of community engagement in my space. But the services we provide at OurBridge for Kids are direct services, I should say, our after school program and our family support services. So our after school program, just in general, our mission, we work with newly arrived and first generation immigrant and refugee families. We're based in East Charlotte. We do have a site in Southwest Charlotte too. So we're about 15 minutes from the UNCC campus. And so we love to see UNCC students out. But like I said, our two direct services, our first one being after school programming. And that's like just a light word for what it is. It's very culturally responsive. It's a place where you have kids that can, are speaking Arabic or speaking Spanish or speaking all kinds of different languages, Kareni, in one space. And they all feel very welcome, very included, and very seen. We do work with kindergarten through eighth grade students at our East site, the one closest to UNC Charlotte. And I mean, outside from the food we serve, the books on the shelves, the lessons that we plan are very intentional and relevant to the cultures our families come from and the cultures present in Charlotte. Our second service is our family support services because, we've worked with kids. We've been here, we're on since 2014. And our families would come and ask for, specific supports with school questions, with bus questions. And really after 2020, our family support team has really come to what it is now and honestly has developed further since the presence of Border Patrol in the area, Charlotte's Web in November. But our family support services are our main services for our families and how we're able to work with them. And everything is very community centered, just like our after school programming is culturally responsive. We base all of our work based on what our families are advocating for, what they're requesting. It's never like a charity based thing or assuming that these are things that our families need. It's really based on those one-to-one relationships with their families. And the reason why we really love that space is because we are able to support our families in their home language. So just across from our staff, we can speak 23 languages. And if there's a family that comes in and there's no language, we rely on volunteers to get that out and translate as well. So those are our two main services. And then a little bit about myself, also a UNCC grad. So I was an elementary education major and taught elementary school out in Cabarrus County. before coming to RASE for Kids. And I'm about a year in my role, but I actually found this through an internship. So I think it was really cool. And during my undergrad, I helped with the program evaluation and learned about community research and just super neat things like that, and like learn what the nonprofit world was. So it's awesome to be back. And in my role, if you're ever kind of engaging with us as a volunteer or, you know, just as a community member, you'll definitely cross paths with me. So that's about OurBridge.
Thank you, Amelia. I appreciate that. And we're definitely going to come back to, I know you mentioned briefly some of the issues that have been impacting our local community, and not just our local community, as it comes to immigration services and some of those ongoing um, issues. We'll say that. We'll come back to that as far as how it impacts and like the impacts that you're seeing when it comes to the communities that you're working with as well. And lastly, and not least, because we're going to come back to all of our fantastic panelists here, I want to bring in Alma, excuse me, Alma Hernandez, who is with International House.
Okay. Yes, thanks for having us. Thanks for inviting us. So my name is Alma Hernandez. I have been with International House for about 11 years. International House has been established here in Charlotte. It's our only office. We've been here since 1981. And its goal, its mission is to work with the immigrant community and the international community and help that community thrive. We do that through a lot of our programs, whether they're direct services here in-house. We collaborate with a lot of other nonprofits, a lot of community organizations throughout the year to kind of help bridge gaps and help people feel welcome and safe. I am actually, personally, I have a big connection with this organization just because my family members immigrated here, back undocumented back in the day, and went through the whole path path to citizenship. So I understand that background, and I have a deep connection and understanding for that community. That's why I'm here. That's why I've been here for 11 years. But International House has different programs. So we work with children in elementary school level all the way up to adults, depending on the type of program that we have. So we have 4 main departments here. We have our citizen diplomacy department that works with international groups, helping bridge those gaps, soft diplomacy. We work with different organizations throughout the country on how to better inform people and how to get them engaged and how to share ideas on what they do. We also have our education department, which provides adult ESL classes, citizenship preparation classes. We do English conversation hours, for different, I think it's like 20 different workforce developments. All of our adult English classes are free. You just have to register. I think I said we have to do citizenship preparation classes. We also do, for the youth during the summer, we have a Rise in Readers program where we help bridge that gap when students are not in school so that they retain their English capacity. And then throughout the regular school year, we have an after-school program. This for the same is to provide opportunities to expand their ESL and whatever the curriculum is at that time. We also have a community engagement department where we have a lot of international programs to help people get engaged. So we have an international book club, we have like 12 different conversation hours in different languages. We have people of the world events to come and learn about the different cultures that exist here in Charlotte. And then we also have our immigration clinic, which is where I work, where we help people get immigration legal work. And that is open to, we unfortunately aren't able to accept every type of immigration type of case. The majority that we do are for people that are looking for a path to citizenship, so people that need to get their green cards, renew their green cards, family-based petitions, work permits, things like that, citizenship applications. So we have various departments. there is some overlap. We do have sometimes people who come in here or recently arrived to the United States. They're going through a resettlement process and they'll come to us for English classes, improve their English. Eventually, we will help them get their green card. And then from there, they apply for citizenship and then they bring their family members in. And then the family members kind of go through the whole process. And in the meantime, they're participating in our community groups to connect and improve their English, and then their children's become part of our Rising Readers program. So they do accommodate or participate in various programs, and like OurBridge, we do get impacted. We're always shifting based on what the community need is, and depending on what's going on, right? So it's when the Ukrainian war started, for example, we had an influx of Ukrainians, and so we had to kind of shift gear, and in order to how do we work with this group of people and assist them in the way that they need assistance. So we're constantly always changing. We have our main departments, but within the department, again, we're always trying to adjust for community needs.
There we go. All right. Thank you so much, Alma, for rounding out this introduction to the work that's here. Because I want to make sure we take some time to really connect, right? So I don't, when we were putting together this, or when I was putting together these panels, it wasn't the idea of we're going to have like certain organizations, communities, kind of like there were natural fits, like the assumption being like immigration, international communities, like that type of thing. But we do know, and I want to speak from that social work perspective of intersectionality, that our identities overlap in various ways, right? And those ways are not necessarily ones that we might think about. And individuals, as we're living our lives, we don't necessarily think of the identities that we are hold or that are placed upon us. We live and we move as we do. I'm curious, and Melinda, I want to touch with you here. And I want to try to see if there's any connections that y'all can share as it relates to the work that the others do. So when it comes to disability-based needs, are you aware of, Melinda, any services or needs that you've seen within the community as it relates to immigration or immigrant communities within the population of disabled individuals, as well as in with the local area of Charlotte or North Carolina itself?
Oh, so without a doubt, right? I mean, unfortunately, it bleeds into every facet of a person's life. So many of the services that a family would have if they have a young child with autism or some kind of diagnosis would fall under early intervention services, right? We don't ask immigration status for a child or an adult that we provide services to. That said, we know that we're supporting many families whose families include people who are undocumented. And so they are living in fear that their child, who is either in some kind of after school program or day program specific to children or adults with disabilities, that they too will be taken away and separated from their families. Those issues are very real. We are occasionally, more often lately, asked to provide documentation about a child having a disability to keep on that child. That's not something that we can do. It crosses lines of privacy and all sorts of things. But we know why it's being asked of us, because families will do whatever it takes to keep their family together, intact, whole, and healthy. And they want as many partners with them to do that. And that absolutely includes disability organizations like mine.
Thank you for that. Thank you. And I think that also speaks to, I mean, what you've gleaned there towards is those complex issues and as systems and systemic and educational and like that professional level, we use language like those issues. But when we're talking about issues, we're not talking about we're talking about people's lives, right?
Correct.
So the impacts to people's lives that you've seen, speaking to that at the level when we have a system that we love to speak about child welfare, we love to speak about communities who are highly impacted, but sometimes we don't go as far as also including communities who otherwise might not get that support or that ability to say, hey, yeah, you too, or to be included in that conversation, that level of inclusion. So to that point, just kind of continuing that conversation, Amelia and Alma, when it comes to your work with your communities, what's it look like when it comes to seeing needs related to disabilities? Do you see those needs or are you aware of? And again, that's not assuming that you're, clinicians or you're diagnosing, but do you come in contact with those who have needs of disability services in the work that you do also?
Yeah, we do. It's like you said, it's not our position to diagnose, but we make an effort to always get connected with other nonprofit organizations and just even community resource, not necessarily nonprofit. So International House sometimes gets the nickname of 211, the other 211, because if someone doesn't know where to go, they come here because they know at the very least we're going to direct them where they can potentially get some kind of assistance or some kind of contact information. But out of the needs, because it's not a service that we personally provide, we do a one-on-one navigation program to kind of figure out exactly what those needs are so that we can properly direct them, not just give them a list and then they're having to call or go and try to figure things out on their own. And we also started like a women's support group for mental health for immigrant women. So again, it's kind of we're seeing where the needs are as people come in and the questions, the inquiries, like, hey, where do I go for this? And then it's like, wow, there really aren't that many places or none at all in Charlotte where you can go. So then it's like, well, what can we do? And we try to fill the niche, but knowing about like OurBridge and ARC, like knowing those places, we're constantly referring people. So we're always making an effort to kind of stay in the know and appreciate things like this, right? Because it provides us with more information so we know that we're properly referring people.
Yeah, mirroring exactly what Alma said. On our side, I can't speak too much on our family support, what they do on a day-to-day. Same thing with their after-school programming, but I think this is, at first I said, well, these are our direct services. I mean, we have on our end, one of our like pillars of our work is community engagement, and it's a program in itself, just not a direct service program. But like we have experienced all this, like how do we navigate these things when they come? When we have all these varying needs, like how do we get our families connected to those resources? And so exactly what Alma said, it's all about partnerships. It's all about community work. It's all about being in these spaces and learning what's out there, so that we can better work with our families and have these, give access to these resources and goods that were, a barrier before, which I know we'll talk about later. But I think, yeah, it's especially in our space, it's very intersectional. I mean, it's almost very broad when we say we work with immigrant and refugee families, like all the things that come to it is just so layered. So I would definitely, like I said, mirror what Alma said and talk about how the importance of community partnerships is just so important in referring our families.
Can I add one more thing, Matthew?
Go for it, absolutely.
Separate from the current crisis that we're in, right? The absolute fear and terror that families have on a low level situation, our normal everyday, we have to be very culturally responsive at the ARC to the barriers and the needs of families whose primary language is not English, right? Most often that is Spanish. And so we really try to make sure that families who are dealing with a diagnosis like autism or something that in their own community, in their own culture, may not have the transparency that many of us that are American born have, that there's so much shame around in different cultures around disability, and trying to meet people where they are, and have materials and people that look like them and speak the same language that they do is very, very important to us. It's not easy. It's not easy to do, but it's important that we try, and we try to find other partners to help us in that work. And that 211 reference was a great way to think of yourself. And I kind of think the same for us. We're a clearinghouse for a lot of calls that we actually can't help. solve that problem, but we know where to go to help a family. We never turn a family away just for information that they might need.
And so this really, to this point in the symposium, that conversation of community and also being able to build within. Because as of yet, look, we haven't heard. Now, granted, we're looking at if you're looking at the Charlotte area, it's a metropolitan area that does have a lot more access than, say, maybe a rural community, or at least more resources. But that does not mean that the needs are met at a greater level, depending upon what the community and the composition looks like. But community resource supports like yourselves needing to also be aware of what else, right? It isn't just about the mission isn't just about one type of thing. It can't be, because there's so many different intersecting needs that could impact anyone. And that might mean maybe not the whoever the human. I love that how you mentioned that, Melinda, because we use so much language. We try to figure out like how to call people people, but I was just saying like you're a person. And maybe less is more, right? Just a person is in front of me. A person needs support. Why do I need to church up the language and just saying this is a person? But the person might not be the one who needs something else. So maybe the person is here, but we know, and this is me speaking to social work students and professionals, what impacts one impacts the rest. So if it's the family is the person, or the family is those, or is the initial interaction, that doesn't mean the children, or if there are children, don't also need support, or the parents or whoever else might be in the household. Like there's just so much there. But that does beg to me the question of, and this goes into maybe a barriers conversation, if you are, whether or not you choose to be the 211, what's that look like for the time and the resources to be able to, be a umbrella of sorts, right? What's that look like for you all when it comes to being able to meet those needs? Are there barriers that are making you more of a multiple connection service, that if those barriers weren't present, someone else could also be a part of the conversation, or some other service could maybe take a lead more without you having to tax your limited services, because we all have limited services? Is there something happening that is asking you to do more than you otherwise would be able to if that barrier were removed? And that's a large one, right? So whoever wants to, I guess I'll start with Alma. You mentioned 211 to start with. Are there what's some of the barriers that you're seeing that are causing you to maybe be more responsive than if those barriers weren't there?
Well, for sure, we see a lot with our immigration legal department. Um, with this current administration, and we experienced it back in 2017 as well. When everything started in 2017. It's there's right. I think we all agree there's just a lot of fear, and so if immigration law is constantly changing and putting up tons of hurdles for people who have a legal pathway to see their path to citizenship. It's like, I feel like something's constantly being put up to delay or to prevent things from happening. And it does cause difficulty for immigration attorneys because now, instead of sending in one application, now you're having to redo it because they decided to add one line to the application, or they're asking for a lot more evidence that wasn't required before. And then, putting these countries on a ban list that affects our clientele. So every time something like that happens, it really creates delays for us because it keeps us from taking on new clients, because we have to now readjust the clients that we're currently working with, right? And to be fair, to make sure that we're giving our current clients quality service, we have to make sure that we take care of them before we can start taking in new people. And it's created a backlog, right? So people have to wait months before they can receive legal services from us. And so we collaborate with other nonprofits that provide legal services, but they're also backlogged. And so now you're finding people who need legal services that are waiting months and months and months, 6 months, or they don't have the funds to go to a private attorney. And then in the meantime, things keep changing, deadlines keep changing, and every time something gets announced, we get bombarded with phone calls and emails because people are scared. Oh, he said some, excuse me, administration said something about green cards, and then our phone lines are flying off the hook because everyone's like, I need to do this now. We just don't have the capacity, and it's just a trickle effect. One organization gets full, the other nonprofit gets full, and it's just a domino effect, and then our community is kind of stuck. So that's what we see. We see that all the time.
Mine's not that different. Oh, I'm sorry. Sorry, Matthew, were you gonna ask a question?
No. I was actually going to start directing. You're good. Go for it.
Yeah, so my side of the organization is the advocacy. It's the non-billable side. It's the families that are emailing, they're calling, they're walking in the door. And so we're limited only in our ability that there are only so many hours in a day, right? That we can only help so many people a day. And that's it. It's me and it's one other person on my team that's doing this. For everything else is billable. And so what's tricky for a service provider like me is that we rely on Medicaid and reimbursement rates from the state in order to do our work. And so much, I don't know. I mean, I'm a social work person too. I don't know how much you get into to that kind of work, to the nitty gritty, but there's so much work that has to get done to support a family with a billable service, but so little of that is actually billable at a rate that is going to provide for the staff providing it and do good work. There's so many issues in there. So there are so many times that our staff can't tackle the real pressing fear-based crisis issues for a family because they simply don't have the bandwidth, and it's not in their job to be able to do that, because if we don't bill every single second, every single day for these families, we don't stay in business anyway. So it's a real struggle to do social work, good social work in a in a Medicaid reimbursement system.
No, and that's a really good point. I'm going to go to Amelia here as we're talking, as we're continuing this conversation of barriers. We're going to come back to this because we're looking at that policy conversation as it relates to, even the budget. In North Carolina, we still don't have a budget, and what that looks like when it comes to providers being able to provide services. But for Amelia, for the work that you do with OurBridge, what's that look like for being able to support communities, or the barriers that you're seeing as well?
So like I said, I can't speak on our family support team. I wish they could be here on their sort of day to day. But I guess what I can kind of speak on is just our experience just so far. And when we do start hitting capacity and the courses we take in that sense. So, our family support team works with mostly our families from the after school programming, but through different partnerships with like CMS, we start building caseloads. And then of course, if any family, kind of what Alma said, like if they walk through the doors, we will support them. And we're honestly in the middle of that since that Border Patrol. So it's an interesting conversation that we're having ongoing, because there are, so many other community members involved, and how can we expand that? But what we've done in the past is same thing, reliance on our community. We partner with Atrium Community Health Workers to try to reach those spaces where we can't. But ours, our barriers are just that capacity. Like what do we do when we can't take on anymore? And so like I said, we're still exploring that. And I've known that community building is still that sort of answer and how we've approached it so far. And then just, of course, the tons of policies that could change and just support our families in a better way that way.
And to all those, and I want to get to a point that Melinda, you started with when it comes to your advocacy that you've been working on. It's a very responsive, and not just responsive to the people in front of you, but responding to the things that are outside of all of our controls. As we are not policymakers. Now, granted, if you're listening to this and you want to be one, please go for it. Like I would love to see more folks within the spectrum of what we're discussing be a part of those conversations more directly. Because we talked about this in our last session when it comes to funding. Funding was a big connector to access, and not because money is more important than people, but things got to get paid for. Like we live in a capitalist system, and that system says to be able to get one, you got to do the other. So if you want to get a service, you have to get paid for it, be it Medicaid and this reimbursement medical model system, whatever it comes from, and even the general of people's time, right? A lot of the work that we do within these human services, helping social work type roles, a lot of it has nothing to do with anything that would ever touch a dollar, right? It's the call that you take at whatever time that isn't the emergency call. It's not that call that's going to go to, some service that you can, I'm going to document this and get. It's the person who just needs something. You're just going to refer them out, or you're going to just explain to them something clearer. But to that other conversation of now we're advocating for reducing some of these barriers, or trying to, because the barriers they're endless, right? So to your work, Melinda, let's start with you with what you've, if you for what you can share with what you've been doing in DC. What's it like to in 2026? What's it like to advocate for a population, as you mentioned before, which I definitely agree, has the highest level of legal discrimination that can happen, that lives in a world that says, well, unless you can prove it, and that's even more so, again, we could look at the intersectional lens, that has lesser chances of being able to have the connection to a resource that can support them in a oppressive, repressive space to get access to not just support, but also recourse for harm that's been done.
Mhm.
What's it look like to be able to advocate in this space?
Yeah. And it's not even, can you prove it? It's, you have to work harder. You have to work harder. You're not trying hard enough. So let me start at the state. We don't have a budget in the state, right? And most people, and I'm going to say most people 18 and up, because children have a different funding source, but most people who have developmental disabilities who are 18 and up rely on Medicaid for both healthcare and access to other kind of services like care management or case management, some of those lesser known state funded services. We don't have a budget. And so when you don't have a budget, there's a real problem. And our illustrious General Assembly decided to just slash the Medicaid reimbursement rates without a budget this year. And that advocacy that was required for that to be reversed, which it was, included us hiring an attorney, and signing on with a bunch of other different trade organizations and nonprofits to say, you can't do this. You can't do this. You're going to put providers out of business. You're harming the very people that you are there to support. You can't do this. And they reversed it. Now we still don't have a budget, and we're terrified of what is going to come down the pike when it comes to SNAP, when it comes to our emergency rooms, all of the things that are Medicaid funded. Federally, it's a little bit different and still just as tricky. I did not say this in the beginning, but I not only do this professionally, but this is my personal life too. My husband and I are legal guardians and permanent caregivers for his younger brother. He's 45. He's lived with us or near us for about 20 years. He has intellectual disabilities and some co-occurring mental health struggles. He requires Medicaid. The reason that I can go to work every day is because he has the services that he needs to keep him independent in the community. He goes to work every day. He lives in a place of his own that he can afford on a very low income and accesses community services. That's all Medicaid dollars. I can go to work because of those things. If those things get messed with, lives truly are at stake. And there are some real antiquated policies at the federal level that prevent people with disabilities from having any assets at all. It's a system designed to keep people poor. If you take any kind of Social Security, SSI, SSDI, you can't, if Medicaid, you cannot have more than $2,000 in your name or you will lose access to Medicaid. That is outrageous. It's archaic, and it is a quick change in the law that we haven't done. You are penalized in this country if you are two people with a disability who marry each other, because they decide that you only get $3,000 of asset instead of $4,000. So you can be a person with a disability already pushed down, and then you decide to get married and they cut that in half. Those are little things that we were in Washington, D.C. trying to advocate for change. The other thing that we were doing, and I'll give my colleagues a chance to talk, is making sure that our legislators on either side, because it's important in advocacy work to build bridges, to build rapport, to build relationships, even with people that don't vote the way you want them to vote. Building relationships is important because that is the way the system works. You have to find common ground. I believe that disability is the great connector because nobody is unaffected by it. And so you have to teach people and share stories that are personal to legislators and legislative staff that might make an impact. I have to show certain politicians in Washington, D.C. when I go up there that this person with me just isn't not working because they don't want to work, or that, that they're not lazy. They're not, they're not there's no fraud, there's no waste, there's no abuse of the system. Those are just words that we like to use to cause fear. These are real people impacted by the good work that we're doing, and they deserve the same thing that you and I do around this table. Preach over.
No, but you preach over but continue, right? Because you made a lot of really great points there, especially when we're looking at this poverty conversation. And if roughly 50% of the population lives in poverty, I'm sure the number is higher than that, or at least of the population that lives in poverty, 50% of them are on a fixed income, roughly. And that fixed income is something that's decided at the state and federal level. It's not something they decide themselves, hey, I want to reduce my amount of income that I can take in. I don't have any choice but to live within this measure. Otherwise, what I get shut down. I get it's money that I can't take it in. I cannot, not because I don't want to be more of a participant in society, but if I do, I'm penalized, right? So that's a huge one because it sounds like a conversation of, you mentioned education. You're talking about reaching in either side of the aisle because we have a very partisan legislature, a very partisan system right now. But for the needs, and this I think goes well with the international, the immigrant, and this larger conversation of including, it doesn't matter who you are as long as you're willing to help, right? If you're going to be supportive of, if you're going to help us, let's have a conversation. But sometimes that means going to people who otherwise don't see you as a human being. And I think that's the unfortunate part of some of the conversation is having to educate humanity, right? How do you do that and feel whole in yourself? So to that point, as we're kind of winding down the last 15 minutes, I want to open up to Amelia and Alma as well to speak to the advocacy because Amelia, I know you've been talking a lot about like your work when it comes to volunteers and community work. What's that look like right now for you? Not just because of the hardships as they relate to policies within the immigrant community, but what's some successes or some ways that you've been able to, share and show the benefits of community support within the people that you work with?
I think that that is a very unique space that I'm in, which is I know I can't speak on um like I said, our family support and after school programming, but I think it's just so instilled that our practices are community centered, but I think everyone truly sees it. I think this role and connecting the community with our needs and the needs that we're seeing and the people we work with is just so interesting because I think that's what I hear from the community the most is like, what are the needs? Like, what's going on from an advocacy level, from just I'm here level, I can donate my time, I can donate my money. But I think it's very interesting in that way. And I think I just honestly recently, before we haven't had like a solid volunteer coordinating position to really get our community involved. So I think what we're seeing now is it's almost kind of sharing awareness of our work and how our community can get involved with our work to be able to advocate. And I kind of going back to the question of Melinda and how does that look like for advocacy? I think that our role is, amplification, right? Like community in numbers. I think that we have a specific space where we can join alliances, the Hispanic Federation, Children's Alliance, After School Program Alliance, and really amplify the voices of not just, the people we're working with, but what the community is also feeling on the other side, I should say, of the families we work with. I think it's interesting to see both sides, I guess I should say, because that's how it almost feels being in my position is, this is the population we work with, this is what we do, and here's how we bridge the community to get towards that work. But now I think I'm ranting because I honestly forgot part of that question, but I think it's just an interesting space for me to be in, and advocate for both sides, if that makes sense. I think in the end, what we see and what we take pride in is like, we just want everyone to have joyful experiences. Joy is resistance. And I think that when everyone's in a space collectively, community members, whether it's our families or whether it's volunteers or people who are wanting to get involved, I think when you're in one space, it just shows that inclusivity. It just shows how everything is interconnected. I think you just see everyone kind of come together, and that's the root of our work. We just want everyone to be there for their neighbors. This is, like I said, not charity work. This is just this is the space we should be operating. But yeah, I hope that answered the question. Like I said, I kind of lost my as I rambled.
No, that was great. And you really, I think, landed on the gem with joy as resistance because I mean, any number of pick a thing, pick a channel, pick a scroll, pick a thing. Like, doesn't really matter. It's really easy to find something that can take away our joy, right? And that doesn't mean we have to fake it. That doesn't mean we have to pretend things are great. But being joyful in a space and in a time where it feels like for many of our community members, their happiness is the thing that is not wanted largely. Like the idea of their being able to, like what Melinda was mentioning, like living independently, like that should be a goal and a reachable goal for like like there shouldn't be a point where we have to like decide like who should be able to live independently. No, we should all be able to live in a space where we have access to independent living and safe living and healthy living and all those things joyfully, right? Living a life of joy as a resistance to a system that again repressive oppressive policies restrict access to that. So that I think if you're able to at least plant that seed of concept into the folks that are part of your work or within the organization, I think you're giving them something that maybe not right now. Maybe right now you can't see that being a part of your life, but build towards, right? And to be able to build a space where that joy is an active part of their lives and much less resisting the systems that would take it away. So yes, fantastic, fantastic. Alma, for you as well, when we're looking at advocacy in our current times and ways to especially deal with barriers, because as we get to the point of winding out, we're going to look at how do folks access and support the work that you do. What's advocacy look like for your work with International House, and how can folks support the work of International House as well?
So advocacy for us is a little bit different than like what Melinda does. Obviously, in our immigration clinic, we advocate for our clients, right, when we represent them. But one of our goals is to engage the community as much as possible. I think we're in a unique time, where there's a large portion of charlatans that want to help. And nationwide, right? We're seeing it all over the news. People who have never gotten involved before are coming out and saying, I don't know what to do. I want to do something, right? And so that's another way. So as much as we would love people to get engaged and donate and be a part of International House, we also know that, maybe you have you're kind of pulled heart-wise to something else. And that's one of the reasons we like to stay engaged with other organizations, because we're like, okay, you know what? You want to help us, but maybe your heart is pulling you somewhere else. These are places where you can go and give your time and money and work or volunteer for them. I know one of the things I love when Melinda's explanation of why people could potentially lose Medicaid. Like, I think that's important because we hear snippets in the news and we don't really get the full understanding of what's going on, right? And so it's the same, we kind of get the same here where it's someone will say, well, I don't understand, they're already going to school. Why should I give you money to participate in an after school program, right? So you have to explain, I think that explanation of why it's needed to kind of fill in that gap. And I think that's what a lot of nonprofits do, is to explain like, hey, you know what, your money is going to this because of the way the system is set up, right? It's very, very difficult to break through that certain poverty line, to get through that. And in the as you do, you're facing tons of barriers that are constantly, trying to pull you down. And we're seeing that as well as we move on with the immigration applications. But yeah, that's what we're facing. For us, it's again engagement, and for some people, it's like for us, we can provide some immediate interactions. You can come volunteer, you can help this and do this. And then some people have the skin to do the long run, where you're doing the advocating, with Congress and elected officials, and that's tough. I've done that, and that's your commitments, right? And also explaining to people, you know what, you're not just going to go talk to the senator and it's going to be done. That's that could be years and years of hard work. So helping people understand what the expectations are and helping them find their fit is also, I think, really important for organizations like us, to help people that want to help.
Fantastic. Thank you for that, Alma. Amelia, for you as well, again, as we're wrapping up here, how do people access your services and supports, and what can they do to support you as well?
Yeah, both sides of that coin again, which is how I always see. So for community members to be able to access our organization, I mean, yes, lots of referrals. Yes, most of our families come from our after school programming, but we truly believe in being in the space of where our people are. Like we're doing pop-ups in our family's apartment complexes and tabling there and saying, here's what we are, here's what we do. And it's really all about being in their space. And I think that I truly love that about OurBridge and our work. So I said referrals, even at the schools. So, if they're within our distance, I guess I should say, like we're in the schools and, we're there with the families. I think kind of what speaking on Melinda said, that representation is a really big deal for us. We hire within our families, we hire, our kids' parents to be part of our program. But I think that that's the most important thing on both sides of the coin. So like on the other side and how to support our work. What we see a lot from volunteers who are wanting to get involved or donors who are interested in what this is, I think it's that same concept. It's, we're this is still community based. You're in our community. We're tabling at events that we know, like sometimes it's a market, Chica's market, where we know like a lot of people will be. Sometimes it's, at different organizations, corporations, and things like that. But it's still that same concept of being in everyone's space, tabling, networking, of course, things like this, and just, letting it be known what we do so we can connect with everybody.
Man, fantastic. Thank you, Amelia. And Melinda, same question for you. I know you talked a good bit about and gave some really good gems about advocacy, but when it comes to people being able to reach out to you, especially with you being so, so broad as
Yeah.
far as access to, what's support look like to provide and to reach out for access?
Yeah, the easiest thing to tell people is to go to our website, and two things. One, if you are a person that needs some services or you have a family member, then you just kind of navigate that website until you find, your region. It would be Charlotte. And there's information there, certainly. You can use the advocacy tab to reach somebody in my department for those things. But we have something called e-alerts. So if you and ladies, this would mean you too, if you want more information about the things that we're putting out there for how families can get involved in the advocacy, right? I need everybody to write their senator about this particular issue, and we explain it in plain language. We have e-alerts that go out in times that are critical. Anybody can sign up for those. You can unsubscribe anytime, but we try to be very careful in how we use those. That's also a way to, just kind of understand the issues of the day. And then certainly, if somebody ever just wanted to donate to the ARC of North Carolina and our advocacy work, we are so happy to take your donations, and all of that is on our website.
Now I'm unmuted. Okay. Fantastic to all of you. Like now, this has been, I think, it's a blitz of a few hours of time, and as far as like the overall, but for you all, I think there's So many jewels and gems there when it comes to advocacy, especially that concept was really reiterated across the board for you all of how do you support, how do you not just do the work, because the work in front of you is one thing, but how do we impact the systems that can support our work to be done either easier or improved, as well as make our lives easier and our family members, and because I think that's one of the things. Aside from just our community members and the folks we work with, is we're also part of these communities. Like whether or not we are directly impacted by the needs and supports that we provide as professionals, we're in space. So it isn't just these strangers who are coming from nowhere. They're the people who we often live around and next to or have stories that are very familiar with as well. So I love the idea of, advocacy not just being something that's far away from others, but also something that we also have to continue to educate ourselves about. We also have to continue to learn about the other resources, not just the resources, but if we have a chance to the people. So thank y'all for sharing your stories, for doing the work that you do, for supporting our social community that is broad, ever diverse, which will continue to be no matter what anyone says. We will all be different, and that's beautiful. It's not something that we should look around and go, you know what, let's just be more like each other. I mean, I would love if people love Spider-Man more, but if you don't, I ain't mad at you. But we are all people in our own spaces, and I think that's something that you all do a great job to exemplify in your work, and also do your best to make sure that people have, the access to be able to be more of themselves, whatever that looks like, and not be restrictive to the system that does have its part. But it's not the only thing we're about. We're not just about the system. We're about the people. We're about the love. We're about the humanity. We're about all those things. So thank y'all for being here. I appreciate your work again. For those who are, viewing this, there's other great information you can learn from, but please access the resources by these organizations. Listen to these great people. Connect as you can. If nothing else, learn more about what they do and share that information abroad as much as possible. So, if anyone would like to add a last word in, feel free to. Anything from Melinda, Amelia, Alma, any last word that you all have for this great moment?
Take care of yourselves. If you're going to be social workers and you do this work, it's hard. Don't try your best to I hate the word self-care. I'm getting really tired of it, but
Yeah.
just make sure that you are truly leaving work at work and doing things
Yes.
to take care of yourself.
Yes. 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 Fantastic. That's going to be a great lead into our next session, which will be our social work students who will be discussing. But thank y'all so much for joining us, and I can't wait to connect even further offline and outside this space as well. So thank y'all so much for what you do and for being here.
Thanks, guys.
Thank you.
Thank you.